as we mentioned last week, May is Mental Health Awareness Month.
Dr. Laura Saunders from the Institute of Living is joining us now, and today we're talking about common childhood behavioral health disorders. And I didn't realize there are so many, Doctor. How are you? Happy Wednesday.
Hello, friends, and happy Wednesday.
Yeah, you know, it's hard sometimes to tell because of the pandemic. We've been seeing so many behaviors with children. So what should we be looking for to know if there's actually a mental health issue that needs treatment?
So I'm going to just touch on sort of the 5 to 6 most common mental health disorders in children and adolescents. I'm not going over prevalence. I mean, this, I could do, entire courses on each of these, but we're just going to touch on a few things. Okay, let's start with ADHD. It's probably the most common and probably the most well-known. It's where kids have significant difficulty paying attention, difficulty controlling impulsive behaviors. They do things without thinking. They may be overly active. So ADHD, now kids are active. So what we're talking about is a level of impulsivity, overactivity, difficulty paying attention that hinders functioning. And that's sort of the theme in all of these. Do kids have some level of anxiety? Yes. What we see is that, some anxiety is actually pretty natural. But does the anxiety then, are they outgrowing it where what they used to be anxious about doing something and now they're back being anxious about it again? Unfortunately, because of COVID, we've seen incredibly high rates of depression and anxiety in our young people. So, when there's so many fears or worries, and those fears or worries interfere with home or school, kids feel sad or uninterested. We've had a whole 15, 16 months of kids not being able to participate in things they were previously interested in, which is why we have unnaturally high rates of depression right now. So that's the start.
All right. And then autism spectrum disorder?
Right. So autism is a spectrum disorder, and its challenges or significant delays in 3 key areas: socialization, communication, and behavior. It's considered neurological developmental disorder, and it's along the spectrum. Oppositional defiant disorder is when children act out persistently. It causes serious problems with argumentativeness, defiance, spitefulness, resentfulness, and OCD, obsessive compulsive disorder. We actually, because of COVID, again, we're seeing higher rates of OCD in kids because it used to be you could play, you could socialize, you could do all these things. And now we have inserted into our kids' minds that closeness equals danger, right? So kids have more and more worries about germs and picking up germs than they ever did. But OCD is actually when it, again, tips the scales. They have unwanted thoughts or impulses, and they have to do something to reduce that. It's usually counting and checking. There's hand washing. There's a bunch of other behaviors. So the obsessive thought and the compulsive behavior.
So what do you do about it? And what if you're not sure if it rises the level of an actual diagnosis? Do you start with the school? Do you start with an outside person?
So that's a great question. What I like to say is that in the life of a child and adolescent, there's really 3 key areas: home, school, and play and social. What you want to see is that if these issues are affecting usually greater than one area of those 3, I always think creating collaboration with schools is critical. Schools really know these kids, and schools have great developmental perspective, right? They see, 20, 30 kids year after year after year. They can tell you when someone's behavior is sort of off the charts or really looking different. So are worried that your child's really struggling, you can consult your pediatrician. Pediatricians generally have lists of mental health specialists that they work with, and more practices are doing integrated care. So some of them even have a behavioral health specialist working within the pediatric office, which is even better.
All right.
That is great.
We're out of time for now, but we always look forward to seeing you on Wednesdays. Thank you so much, Doctor.
Take care.
Thanks, Dr. Laura.